My name is Paul Anthony Taylor, and I'm the Executive Director of the Dr. Rath Health Foundation. In previous videos on our YouTube channel, we've described how the mission of our organisation is to improve the health of people worldwide. Of all the areas in the world where we're active, we find that achieving health for all is particularly challenging in developing countries. In richer countries, of course, through the use of science-based, synergistically designed nutritional supplements, it is relatively easy for people to take advantage of Dr. Rath's cellular medicine discovery that deficiencies of vitamins, minerals, and other micronutrients are the primary cause of today's most common chronic diseases. But for the vast majority of people in developing countries, taking supplements to prevent chronic diseases is not an affordable option. So achieving health for all in developing countries clearly can't just be about pills. Instead, it has to be based on improving people's nutritional intake through the consumption of vitamin-rich foods. Health for all also means education for all. Ultimately, health for all can only be achieved if people everywhere are taught about the functioning of their bodies and the vital relationship that exists between nutrition, health, and disease. In the healthcare systems of the future, providing children with health education should commence at an early age in every school worldwide. Achieving this is one of the key goals of our organisation. At the current time, however, the countries that are most in need of health education are the poorest ones. Take a look at this picture. It was taken at a school I visited in Uganda in 2019. The classroom the children were being taught in didn't even have any desks or chairs. In richer countries, of course, people today have easy access to computers and other high-tech devices. In such countries, through use of the internet, information on natural health approaches is available to practically everybody at the touch of a button. As a result, the information superhighway is transforming not just health education, but education in general. But as this photograph reminds us, the situation in the world's poorest countries can be very different. Millions of people in poor countries don't have access to the internet. This means that information about natural health approaches can be very difficult for them to obtain. So, providing health education in poor countries means we have to use different approaches to the ones we use in rich countries. Consider also the fact that today more than 800 million people worldwide still suffer from undernourishment. By undernourishment, I'm not referring to a lack of micronutrients, such as essential vitamins and minerals. I mean a lack of macronutrients, proteins, fats, and carbohydrates. Many people in Uganda are significantly undernourished and survive on as little as one meal a day. We therefore have to ask ourselves why it is that the United Nations, the World Health Organization, and other global institutions are allowing this situation to continue. Why are the resources of these organizations concentrated on approaches that are essentially keeping developing countries in a state of dependency? These global institutions are hardly short of funding, and they certainly have access to knowledge about nutrition. So why aren't they focusing on teaching people in developing countries how to help themselves? Do you remember the old saying, which says if you give a person some food, you feed them for a day, but if you teach them to produce their own food, you feed them for life? This is exactly what the United Nations, the World Health Organization, and other global institutions aren't doing. So what is our organization doing to tackle these global challenges? Well, we now have more than 50 schools learning about cellular medicine in Uganda. The key elements of the approach we are using in Uganda involve setting up what we call school health parliaments, teaching children about cellular medicine in the classroom, setting up school gardens, and reaching out to local communities. Every school taking part in our project in Uganda is required to set up a school health parliament, which consists of democratically elected representatives from each of the school's classes. The parliament discusses health issues concerning the school and the local communities around it. It plans for health projects to be carried out, It ensures the successful running and completion of each project, and it spreads health information around the school and its local communities. Teaching children about nutrition and cellular medicine in the classroom is central to the approach we are taking at schools in Uganda. Using our educational materials, the children learn about the central principle of cellular medicine, that micronutrient deficiencies are the primary cause of chronic diseases. They also learn how fruits and vegetables are good sources of these essential micronutrients. And they discover how heart disease, cancer, diabetes, and other health problems can be prevented through a micronutrient-rich diet. Having learned about nutrition and cellular medicine, the children then set up a fruit and vegetable garden at the school. These gardens become real-life laboratories where the children turn theory into practice by growing the fruits and vegetables they are learning about. Providing one school with a basic set of gardening tools costs just over €100. Again, therefore, we have to ask ourselves, why isn't the World Health Organization doing this? Reaching out to local communities plays a vital part in the approach we are taking in schools in Uganda. Having learned about nutrition and cellular medicine, and how to grow micronutrient-rich fruit trees and vegetables, the children are then encouraged to share this knowledge with their parents and neighbours. As a result, our work in Uganda has seen more than 12,000 fruit trees being successfully planted. In all, more than 100,000 people in Uganda are now benefiting from these initiatives. This is Health for All in action. To illustrate how our work in Uganda is improving health and transforming lives, let me tell you about a young girl I met when I visited the country. Inspired by what she had learned at her school, with the help of her uncle, she set up a passion fruit garden at her home. She originally started with just 54 seedlings. Today, from selling her produce, she's earning enough money to pay her school fees. This showed me that economically too, our Uganda project has huge potential. If you'd like to collaborate with us to make Health for All possible where you live, please contact us. If together we take the right steps, improving health and transforming lives is possible.